Dental Soundbites bonus content.
Hello. I'm Dr. Arnell Wright.
And I'm Dr. Effie Ioannidou.
Welcome back to Dental Soundbites. We're having a conversation about workplace safety with Dr. Ann Blue.
Arnell, have you ever experienced any aggressive patient?
Yeah, I have. I've had patients kind of get in my face. I've had different kinds of encounters, and like I've spoken about some of them on some of our previous like sticky situations episodes from like the previous seasons. But one that I remember, I will feel that's like a little recent. It was actually not one that was directly related to me, and although I'm going to say like I was glad that I was not involved, but I did end up having to get involved because it started to go to the left. And sometimes I like to just, if I'm not brought into the situation right away, I'm like, okay, they are managing it. Okay. But then I hear the patient down the hall kind of, starting to yell and starting to say, well, I have something going on with my heart and you're making my anxiety go up, because the volumes just started getting louder and louder and louder. I was like, okay, so now I got to come out of my office and make sure that I do get involved in this. And I was like, hey, I'll take it from here. But this was like a recent incident where there was a patient who was unhappy about a partial. They had not been in the practice for maybe 7 months. I had sent letters to try and get them in. And I guess they just decided that they were going to come, whenever they could come. And, things changed. So there was like an immediate partial, and then there was a final partial. And so when they came in for the final, they had been in this temporary and things had changed. And so we were like, all right, so we need to kind of go from scratch. And the patient was just, it was a lot of things going on, but the patient had been an upset patient from the very beginning. And it was one of those cases where I was like, I always want to be the person that kind of starts and ends with the patient, just because I wanted to navigate it very strategically, if that makes sense. And sometimes I believe in knowing your personnel. So like knowing your staff on what their strengths and their weaknesses or their challenges are. And so in this particular instance, I was with another patient, and then I went back into my office to send a script. And then that short period of time, things kind of escalated, and the patient was like, well, I have my husband. And I was like, okay, I need to get involved. And then she actually did compliment me on like my demeanor, because I love human behavior, and I'll get to the point in a moment. And so I've learned to just be like, okay, I'm going to do a lot of breath work right now, even though I was just as like heightened and like stressed in that moment. But I knew the bigger picture was we need to bring this all the way down to like a level of nothing. And even if we part our ways, that's better than it going any further than it's already been so far. So my manager, she actually said, she's like, wow, I learned something. She's like, you are good. And I was like, listen, I haven't always been this good. It's taken a few drops, but yeah. What about you, Dr. Effie?
Crazy things happened in my previous life when I was practicing in Greece, but that was pretty normal for Greeks. As you guys describe situations in practice, I would say that when you practice in an academic institution and you are within a hospital environment, you kind of feel a little bit more secure, in a sense that there is security available, almost 24/7. If you feel that the tones become higher, you have a very easily accessible alternate approach that, you can call security, the people go in there, patients immediately, and the tone immediately will calm down, right? A very weird story that happened a few years ago in the residency clinic, actually in the perio residency clinic, Dr. Blue. We had a patient prepared for implant surgery or whatever one of the residents was ready to do it, and the patient was watching porn.
Oh gosh.
On the chair. So it was a very weird and awkward situation that could have escalated, because you have to find an appropriate way to say that, I see you, hello. It's a public setting,
hello.
All right? Like, this is not your bedroom.
Right.
So it was very weird. Gratefully, it was resolved. We didn't have to call security. But what I wanted to bring this up because weird things can happen, and not necessarily directly aggressive things, but can be really weird and put everybody in a very awkward situation.
Yeah.
And those things can, depending on how you approach them, they can become aggressive.
Yeah, very true.
So it was a very unusual experience that I had.
Right.
I was going to ask you both, since you have academic background, if there are any programs that you all know of that have like human behavior and like more skills training, communication, these things in dental settings involved in their curriculum.
CODA requires that residency programs have
the residency,
some type of a few hours of behavioral and practice management courses, right? But these are not extensive. These are very, very basic. And I know that the majority of the residency programs, I'm talking about perio, the majority of the periodontal residency programs satisfy this requirement with very, very, very little effort. Right. It's not an extensive requirement. So that's, I don't, and dental schools, I'm sure you remember from your time, there were some minimal requirements of behavioral training, but again, not really extensive. And I think as our societies become more complicated, these requirements should be a little bit more advanced.
Yeah.
Definitely. And then, I think I remember us learning more from our instructors and how they handled these patients. Because, our instructors tended to be a little bit older than us, obviously. And, and it's experience. I mean, like you said, Dr. Wright, your experience, when we got out of school, we wouldn't have handled situations the same way we handle now. Kind of a game to see if I can turn things around. Most patients come into my office, they're scared. And when they're scared, some people are scared and they're angry. They're upset. They don't like what you're saying. And, and I've learned to, and I'm just like, okay, I'm just stating the facts. You don't have to, you do not have to do anything. People can survive without teeth. But this is the situation we're in, and I'm going to try to help you manage it. And just be empathetic. But, patients come in angry. And it's a wonderful feeling when you're able to turn that anger into, where they feel like they're being heard and that they're comfortable with you. And I think a lot of times as females, especially, we get sent some of these patients that may be more difficult because they feel like we have more empathy. And we do. I mean, I think we do as females. So.
I agree.
Sure.
It's all females right here. So here we are.
Yes, Girl Squad.
Yes.
Thank you so much for joining us, Dr. Blue.
Yeah, thank you so much for being here.
Well, thank you for having me. This is an important topic, and, it's a good one that we're tackling with that.
Thank you.
For our listeners, if you think your team or a colleague needs to hear this episode, please share it with them. It takes less than 30 seconds to share it in a text, and it will keep them informed on how to maintain workplace safety in the dental office.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.